My name is Jesse. I'm from Sloane, Stecker in West Palm Beach, Florida. We've been using the Tecar for about a year now. I'm having some really cool results with it. Patients really enjoying it. Figuring out some really cool stuff. So I prepared together a couple of cases today that I've been working on in regards to the upper extremity and the shoulder. The first of which is a pretty interesting one and allows me to use a couple different settings that I really like to dive into, like some of the subsettings. And yes, that's what we're going to get into first here today. So the first case I have, this is a case of a 34-year-old female. She underwent a long thoracic nerve decompression surgery. Originally, she was having like intense scapular winging, issues with circulation, numbness, tingling going down the arm and the shoulder, and had to go through and get surgery where they did a resection of the anterior scalene to decompress that nerve. After the surgery, she was having pain with all upper extremity, overhead motions and exercises, as well as was dealing with a lot of intermittent numbness and tingling. Her main goals, as was with the surgery, were to decrease her post-op pain and return to exercise independently. So I'm going to start to share a little video, if you guys should be able to see on the side here. Turn the volume off. I'm just going to talk over it a little bit. So manually, my setting for her, I had to keep the heat a little bit low. So I'm using
Jesse, we can't see the video. Sorry to interrupt. I think you'll have to. No, it's not on the screen there. You might have to select that when you screen share. Like stop this maybe,
okay.
And then I'm not sure.
Oh, okay. Try this. I think this will work now. What about
there
now?
You go. That's it. Yep. Thanks.
Okay, cool. Okay, restart. Video's playing. You guys can see it. All right. So with this patient and having circulation issues, I found that I had to keep the heat pretty low, and I'll begin to talk about why. But what I did to do that was I set up a swap setting between the RET plus and the deep CET, and I held it at about 20%. With the things that were going on with her nerve decompression, I found that if I heated her up even to like 30% or 40%, things would get very red and hot on her and would actually increase symptoms. So it was like I was increasing a level of inflammation that was already occurring. So this was the setup I used. You have the ground sticky on her thoracic spine. Very similar to what Dr. Tucker is saying, like very strong believer in that a lot of shoulder stuff is coming from the T-spine, or it has an influence on it. And then I have the RET plate on the, like still the proximal part of the upper arm over there. With the deep CET, I'm just performing a friction massage over some of the shoulder extensors and the accessory muscles of the deltoids for shoulder flexion and internal rotation, as well as just trying to give a light level of circulation to that area to prepare for exercise. A lot of the exercises I'm trying to get her to do is shoulder flexion, shoulder extension, scapular setting. So on the table, this is what I'm getting her prepared to do. I know this is like a little weird prone 3/4 setup here, but again, like with these shoulders and these long thoracic nerve compression symptoms, like she gets a little bit too much compression to the shoulder joint there, like it feels that it gets painful. So this was a good way to kind of distract the shoulder while doing a couple minute long manual treatment to prepare her for exercise. And again, the manual settings are there in the yellow. And then this is about to play out in a couple seconds here. You guys get the gist of this one. So I'm going to move into what I did actively with this patient. Give me a second here. Okay, perfect. You're just going to see me switching on and off, but I got it cleared up. All right, here we go. Actively still going through a setting that is delivering the electricity where I want to go to and delivering the circulation where I want to go to. What I would do is RET plus to RET. I didn't put it on this one, but I was usually doing a low pulse with a low beat and a dynamic of 30%. So this is a subsetting which I actually like to use a lot, and I'll tell you why, especially for her. With the low pulse during the RET part, you're able to bring down the heat for a fraction of a second. So I'm not overheating it too much. However, when it switches to the RET plus, I still have the low beat on for that muscle activation. So it was allowing me to keep heat low, but still keep like a 30% for getting a little bit more activation with these the low beat on. So that was a pretty good setup here. She's just using some isoinertial resistance of a D2 flexion pattern here. Just again, to get her into overhead motions. You can see she's getting overhead here. A little compensation, obviously, at the cervical spine that you see. But again, allowing the patient to kind of have circulation, influence on kind of getting muscle contractility with not overheating a patient that could have over-inflammatory issues in the upper extremity. Something I wanted to go back to, I guess I can kind of do it in this image right here. In regards to having like a long thoracic nerve issue, it's very challenging to teach your patient the anatomy of what's going on here. But for me, it was cool to teach her that I have a pad on your thoracic spine. This one was a little lower. I just had to get it anchored in her shirt. But usually on her thoracic spine, where I have the long thoracic nerve going, where I have scapular attractors and serratus over there. So I tell her that the current is passing through your thoracic spine, through your glenohumeral joint and into the serratus muscle here. I'm directly working on the areas that need to work for that nerve to be functioning properly. So I think the Tecar was also like a really useful way to teach the patient anatomy in this scenario. If anyone has a quick question